coming up for 25 minutes to 7 now on SA Tonight. We are awaiting that health briefing, which is due to happen sometime this evening. Health officials have gathered in Hammanskraal. 21 people now confirmed to have died of cholera in that area, and a 22nd person in the Free State. So the national toll from cholera now standing at 22. Let's stay with health issues, but move to a very different challenge. And it turns out it's not your imagination. Cancer is on the rise in this country. Stats SA's report into cancer trends between 2008 and 2018, which came out just a little earlier this year, shows that in the 10 years under review, breast cancer deaths alone increased by over 42%. Cervical cancer deaths increased by 50%. Now, those are just two stats in a very alarming raft of information about the hold that cancer has on South Africa, and in fact through Africa, if we look at the WHO and what they're saying about cancer increases on our continent. Let's speak now to Salome Meyer of the Cancer Alliance. Thank you so much for joining us. So this Stats SA report is a 10-year compilation of information, and I think it's the Cancer Registry and a number of other ways that they gather the information. But it shows that cancer deaths increased by nearly 30%, is it, during this 10-year period? So first of all, do these figures surprise you, working as you do with cancer on the ground?
So cancer deaths in South Africa, yes, has been reported with that alarming increase. And I think that what we need to say to the listeners is that cancer deaths in South Africa would have increased, because if one has to compare it with the incidence reporting, where your incidence reporting in South Africa is not necessarily reporting the true incidence of cancer in South Africa, then yes, cancer deaths in South Africa would have increased, because if you then start looking at the Department of Statistics or Stats SA on how they report and record and start looking at data quality, we would have seen an increase in cancer deaths. There's many problems that are associated with cancer and cancer management in South Africa.
We're going to get to that in just a moment. So does this report show conclusively that cancer is indeed on the rise?
Yes, I think there is a very conclusive increase in cancer in South Africa.
Yeah.
And I think what is important about this report and what we need to understand is that with your incidence reporting, as well as with your death reporting, one is able to then actually say, how well are you managing your cancer in the country? So if we are saying that our cancer deaths has increased by 30% in a 10-year period, it actually shows that we are not managing our cancer properly in this country.
All right, so we'll speak about that in a moment. Do we know what's causing the rise in cases? Is it late diagnosis?
So your causes in terms of increase in cancer incidence, as well as I would then say in cancer deaths, is very much related to the access to cancer services. And number one, and we start there at primary healthcare level. You mentioned breast and cervical cancer particularly. Now, for those two cancers, there are dedicated policies in place. However, only for cervical cancer is that written into the ideal clinic framework of the country. But breast cancer is still not reflecting in the various provinces, meaning breast cancer services. So the ability, so yes, on the one hand, we have what we call policies. But on the other hand, what we have is we have an inability of provinces to actually implement policies because they do not have the associated budget for it. So when we start looking at what are the screening, the ability to screen patients at a primary healthcare level, and then to create those very specific pathways for care to diagnostic and treatment care, and again back into the community for your supportive care, we have a complete absence of those care pathways. Cancer is a very difficult disease to manage, and it's a complex disease to manage. And without those care pathways, we find that the majority of our patients that access the public sector, which is 84% of the population, they present with late-stage disease. So when they present with late-stage disease, it's a challenge to actually manage them from a treatment perspective, and therefore, yes, they will then die sooner than what a patient would have if it had been picked up at a stage 1. And that is the particular challenge that we have in South Africa with regards to cancer care. And that is why it is so important that reports such as these are interrogated and actually taken seriously by policymakers in this country to literally then say cancer should be a priority.
And I mean, you know, it's such an important point. What we know about cancer is early detection can save a life. So we're lacking in early detection, and then we're lacking in a proper treatment and support path once that cancer is diagnosed. These stats are before COVID-19. Now, during the COVID lockdowns, there was a lot of talk about how diseases like cancer were going to be neglected. How much worse in reality do you think our cancer stats actually are, given we've gone through 2 years of lockdowns where people were avoiding hospitals, given that there are already inefficiencies in reporting cases? How much worse do you think it actually is?
It's very difficult to actually completely say what the figure is, but we are definitely worse off for the period of COVID. Many of our patients did not have the access. And then I'm talking private as well as public sector patients did not have that access to early detection and screening for their cancer. And that has now had a snowball effect with regards to the treatment of cancers. And what we also have seen in the public sector very particularly is the cutting down of human resources, meaning posts that are your healthcare professionals. The posts are being frozen because there isn't money in the system. What we're also seeing, there isn't money in the system to pay for medicines, essential medicines. We've got one province where their essential medicines have not been paid, and therefore the oncology sector cannot actually treat some of their patients. So those are the kind of snowball effects. Patients that are fortunate to access the private sector don't necessarily have these problems associated. But we're talking about the public sector where 84% actually have to access those services. And I can just say, we're still sitting with Charlotte Maxeke, where that hospital in particular, we still have a backlog of more than 3,000 patients on a waiting list.
Gosh.
It is now nearly 3 months since the Treasury of Gauteng Health has made money available for the backlog of radiation services. To date, nothing has happened.
This is shocking.
So there's an ineffectiveness, that's all that I can call it, to actually manage cancer in this country.
And thank you so much for highlighting these issues, because we know there's a divide between those who can access private health care and those who can't. When it comes to cancer treatment, you've sketched out so clearly how deep that divide goes. But we know generally that people in urban areas should have better access, but telling us that Charlotte Maxeke is still with massive backlogs after that fire. And thank you so much for speaking to us this evening. Such an important issue, the impact that cancer is having on our communities. Thank you, Salome Meyer of the Cancer Alliance. Cancer is on the rise, and it is cancer deaths increased, I'm going to say this again, by nearly 30% in the 10 years from 2008 to 2018. This is not even factoring in what happened during COVID-19. Stay with us.